Good morning, good afternoon, and good evening to everyone across the world who has gathered here today to focus on the needs and challenges of 2.5 billion women who will be over the age of 40 years by 2030. If that's not a big enough global problem for us to come together and try to solve and debate it, then what is? What better time is it to do this now? Thank you, Women's Innovation Summit, for hosting this important event. We live in a world today where society has created a lot of myths and taboos around women. And it's really time for us to wake up and break this and take age out of the equation. Women in their 50s, 60s, and early 70s are active, they're engaged, and they're very involved. They become the pillars of their family, their community, and their society. And nothing, and they are not motivated by age. So therefore, we need to ditch these tired stereotypes. These women are living according to their own rules. They're living on how they feel rather than how they ought. They're pushing the boundaries of expectation, and we're all changing the status quo today. That is why I call this generation elastic. Yet, sadly enough, on the other hand, we have all been treated as invisible to the healthcare system. The world flourishes with the spring of life, and anything in the fall or winter years are unimportant and unnecessary. In today's presentation, I will try to show you by actual facts and figures and numbers and projections that we work on every single day at Frost and Sullivan, a financial, from an economic, and from a social point of view, that we're really, really missing the bus. We're missing the opportunity that exists. I will discuss the size of this potential opportunity. What are some of the current challenges that women in our age group are facing, the landscape map, and future directions for growth. In 2030, Frost and Sullivan is forecasting that there will be about 4.2 billion women in the world, of a total population of 8.5 billion. It is very interesting to note that the percentage of women in their reproductive stage of life, or the spring of life as I call it, that is between 15 to 40, will be almost the same number of women who are 40 plus. If we look at a split by age group, we find that women between the ages of 41 to 59 years will be 24%. What does that actually mean? That by 2030, one in every four females will be in menopause. From an economic perspective, what does the picture really look like? In 2020, we know that while 80% of men contributed to the global GDP, only 55% of women were able to do so. Yet, if we focus on gender specific contributions, we find that although only 55% of women contributed to that GDP, their contribution was much closer to that 80% of men who contributed. In fact, if you look at the numbers, it's just a difference of 7 percentage points, 43.5 and 57. In 2020, in the global pandemic, we know that women globally lost 64 million jobs, and that translates to about $800 billion of income that women lost. Despite all of this income loss, despite all these challenges that we face today, our contribution was far higher in economic terms. Yet, in reality, we are highly marginalized every single day. We're marginalized at home, we're marginalized at work, and we're marginalized in the healthcare system as well. Now, this pandemic has really, really exposed the gaping wounds and holes to the system. We found that last year, 1 in 3 women suffered from some kind of physical and emotional abuse. The lockdown also increased the tremendous stress and strain that women had to take and the burden that they had to face for childcare and elder care. In 2020, we also know that there were 7 million unintended pregnancies, and that led to almost 5% of maternal mortalities through this process. We also know in a survey that we did recently that 70% of women across the world suffered from some level of clinical depression or anxiety. The numbers are pretty high in terms of the impact that the pandemic has had on women. So, what are the big problems we're trying to solve today? I think one of the two biggest issues that is not even part of this discussion and debate that I want to bring up is that depression and panic attacks globally in children have increased by 30% across the world today. And most children face some level of depression and anxiety. So that's one big bomb that's going to be waiting to explode. And the second big bomb is the lack of care for senior women, women over 65 years of age. You'll be able to see that there's very little work that is being done in this area. And as women go into the geriatric population, the elderly care women, there's very little services. So this is my next big area of work that I'm focusing on as we move forward. So let's talk a little bit specifically on menopause. We're looking at 1 billion women entering into this space, into this transition of life in the next 5 to 7 years. These women are impacted by a myriad of symptoms. We found that 12% of them said these symptoms were debilitating, 12% of 1 billion. We found that 84% of 1 billion said that their symptoms interfere with their day to day life. Now, this survey was done over 45 countries with using a sample size of almost 12,000 women just in this age group. So we collected a lot of data from many countries of the world, and we have a lot of detailed analysis of this. Obviously, I don't have the time to share that with you, but at any point, if you're interested, we can show you what's going on in Asia specifically because of the high burden in China of elderly care populations. So, what are some of the symptoms that these women are facing? 60% of them are facing some level of brain fog. 51% of the population is facing sexual health issues. So, the numbers are pretty high, and this is coming out of the survey we did last year. So, who are these women? I mean, this is a very important question. Who are these women? I think I want to start by saying that women are expected to contribute $46 trillion to the global GDP by 2030. This is the estimates based on the next 5 to 7 years that we have created. This estimate is really, if we look at it, it's more than the GDP of the two largest countries in the world, US and China. If we look at women in the United States, the average income of a woman in the US between the ages of 41 to 60 years is roughly about $46,000. These women are tech savvy. 73% of them use mobile applications. One third of them like to use some form of a virtual assistant or a wearable technology. These women are very concerned about aging in a healthy way. They want to look good and they want to feel good. Yet, these are the same women that are doing all these wonderful things, but they are suffering very silently. Only 10% of them are seeking treatment. Very sad. So, who treats menopause? So, in a study that we ran 2 years ago, I think, we found that 42% of these women do not discuss their symptoms of perimenopause or menopause with their primary care. And only 1 in 5 women actually get a referral to a menopause specialist. And 60% of the women who actually tried to get attention from their doctors, 75% of them were treated without any solutions. I think what is even more alarming is that as you go into studying perimenopause, is there a definition for this that doctors use? Black women suffer much longer symptoms, 10 years compared to white women. How do you look at the social determinants of health when we're dealing with with this big issue? Further moving on, we find that physicians during their early medical school programs have never been really taught about menopause in a structured way in terms of what is happening today. And 20% of OBGYN programs just only offer training on menopause. So the situation is extremely grim in terms of the healthcare community, which is supposed to protect us and support us about this. So I come to basically the numbers that everyone has really been waiting for all this time. These numbers are very, very new. We have just released them. You probably are the first viewers who are looking at these numbers. So it's great to share this with you. So what we found is that we made a forecast right up to 2030. We looked at the entire digital female technology space. This does not include drugs. I want to be clear. This includes all digital solutions that are used as how we define femtech. It's an app, a monitoring, a support, a diagnostic product, a wearable, anything that is used for monitoring, treating, diagnosing, and for wellness and health. And we have looked at 6 or 7 segments. I've taken 5 time periods here in this study: 2020, 21, 25, and 2030. And really, what we have to think about is that we are predicting that by 2030, menstrual care, fertility, and pregnancy will have the largest portion of the pie right now. It will generate $1.78 billion. In comparison, senior care is only going to be roughly 12 million, and menopause is going to be 227.8 million. So the good news is from all of this that between 2021 and 2020, 2030, using a CAGR, we are looking at menopause growing by around 19%, which is pretty high compared to the other areas. And obviously, senior care is going to be growing the most in the future, but we'll talk about that in another session. The other thing that we did is we did a head-to-head comparison between menopause and reproductive health. And we really felt, is the dollars going to the right places? If we looked at the percentage of population between these two areas, it's more or less the same, 37% versus 38%. The income, you can see women earn less in their 20s and 30s compared to women in their 40s and 50s. So the income is even higher. But yet, if you look at the number of solutions, we have around 20 global solutions right now, specifically generating revenues for menopause, whereas there are over 50 to 100 solutions in the other areas. So there's obviously a huge discrepancy and disproportionateness in terms of where money is flowing today to where it needs to flow in the future. So what I've done for you is that I have prepared a summary of how we look at this market specifically. Obviously, I've not taken perimenopause into care. There are 6 segments in the market, and these are the products currently that are generating revenues. There are 20 odd products. What is also interesting from this slide is really that most of these products come from other areas, and maybe that might be a reason why this specific area is not claiming its own place in the ecosystem of a woman's life. I want to talk quickly about the 12 growth opportunities that I see in 2030 for the whole femtech landscape. And this is obviously covering reproductive, menopause, and senior care. The shocking pink color is the area for menopause that we are concerned with. I've looked at 2 parameters. I've looked at impact of quality of life, and I've looked at impact on cost of care. And what is really interesting is that we have identified these bubbles by the size of opportunity that will exist in 2030. So if we look at some of these opportunities, obviously in terms of quality of life, we're talking of mental health, urinary incontinence, sleep management. In terms of cost of care, we're talking about early diagnosis for diseases such as autoimmune, CNS, Alzheimer's, and dementia. We're also looking at things like sexual health, digital biomarkers. And one of the big things that right now I'm working on is looking at senior living facilities for women over the ages of 70, focusing on what their needs will be moving into their geriatric care age and what that will be, because that is a huge opportunity, I believe, in the future, especially because a third of the population will be moving into this space over the next 5, 10 years. So our prediction from Frost and Sullivan really is that we're looking at a time and space that we need to now move towards creating a gender-specific women's health digital twin. And there is none right now that is available. So we have created a framework of what that digital twin should look like. And I have the opportunity of wanting to share that with you. And this is really, I believe, what the industry needs. We really need to build an all-in-one holistic solution that goes across the entire life and covers a woman's entire ecosystem, really building what I call a personalized, quantifiable, woman based data algorithm where we take personalized data from a variety of different areas, whether it's diagnostic tests, wearable data, history, genetic data, biometric data, social determinants of health data, diet, fitness, tracking, and we aggregate all of that data using key digital enablers. We have big data analytics we run artificial intelligence, cloud computing, and all of that. And that data then feeds into the system using either virtual care, digital therapeutics, or remote monitoring to be able to provide the entire health and wellness support for a woman. And this is really a platform strategy that I see happening, but it's very, very female focused. And you would have different companies within the landscape who could come in and play in that woman centered ecosystem. And this is something right now that we're working on heavily to be able to make the change that we need to make for this industry. So where do we go from here? I think it's very important for us to think of reversing the dialogue, of shifting the dialogue. We need to shift the dialogue from the last mile in healthcare to the first mile. And I think that's very, very critical today. The future is really in gender specific health and wellness. I really believe that. And with social determinants of health so big today, this is even more important. Healthcare, I believe, is not a product. It's not a drug. It's not a device. It is the sum of a woman's genetic, a way of life, our experiences cumulatively, events that happen to us, our zip code. Our definition of healthcare really needs to change. Healthcare is no longer about the absence of disease. That's how we've been looking at healthcare for a long, long time. Healthcare today, by focusing on diseases, I believe we will not be able to be profitable, nor will we be able to create sustainable, healthy communities in the long term. We need to build the preventive and prediction part of the system, which will be very, very integral to long term care. I also believe that mental and physical health go hand in hand together, they cannot be separated. The future really lies for us to work together to build healthy communities. We need to enlist the support of businesses, medical providers, government, and nonprofits to be able to work together to create this healthy world. And I really enjoyed this presentation. I'm happy to answer any questions for you. So do let me know if you have anything in mind that you would like to work on, collaborate, or have any research. I'm very, very passionate about changing the status of women for health today, and I look forward to working with all of you. Thank you so much and have a wonderful rest of the day.